Mhm. Okay, so the date is Friday, November 27th, and it's 11:30 right now. Hi, Mr. Krishnadis. My name is Athira Nambiar, and I'm going to be your student physical therapist today. Before we begin, I'm actually going to place this gait belt around your waist in case you happen to stand up. It'll just make it easier for me to catch you. Can you lift your arms up? Thank you. There we go. And then I'm just gonna tuck this in behind you. Okay, you can put your arms down. Okay, so I hear that you're diagnosed with chronic bronchitis, and today we're just gonna do 3 tested measures to just assess how you're doing. I'm gonna start by just looking at your general appearance, and then I'm gonna auscultate your lungs, and then I'm gonna check your chest wall motion. So to begin with general appearance, most chronic bronchitis patients have hypertrophied accessory muscles. So actually, if you would remove your shirt, okay, so most chronic bronchitis patients have hypertrophied accessory muscles, which means that the neck muscles, the neck respiratory muscles, would be tighter because you have an increased work of breathing with the diagnosis. Chronic bronchitis patients also have cyanosis, and that can be mainly found in their lips, fingers, or toes. And that just means that you're a little blue, and that's due to hypoxia, and that's just poor circulation in some sense. However, there's also digital clubbing, which is in your fingers and toes, and that can be when they'll almost look swollen up in your nails, and it's like little bulbs. This is a sign that it's chronic hypoxia, which means you're not getting enough oxygen chronically all the time. The last one is obesity. So with chronic bronchitis, one of the general appearance or like signs is obesity. We can measure this by your BMI, body mass index, by just taking your weight and height. And usually if it's a greater than 30, that means you're obese. However, since you are a male, if we measure your waist circumference and that's greater than 40, that can also mean you're obese. If you were a female and it was greater than 35, that would be positive for obesity as well. Moving on, what I'm going to do is I'm going to auscultate your posterior right upper lobe. So could I actually have you just turn and face the tree for me? Thank you. Okay. So if the camera could just come around and see his back, you're fine. Can you see it? Okay. So with the right upper lobe, what we're going to do is we're going to find your spine, which the spine of the scapula, which is like right here. And if he bends down also, you can find C1, not C1, T1, and it would be over. You can come back up. So first we're going to begin by, I think this is the wrong way. There we go. First we're going to begin by auscultating his left upper lobe, posterior segment, since that's the unaffected side. And just breathe normally for me. Okay, and then we're going to look at his right upper lobe, which is over here. And just breathe normally for me. Okay. And you can face me again. So with chronic bronchitis patients, they do have consolidation, they do have mucus. So in his the lobe that I was assessing, his posterior right upper lobe, we would hear coarse wheezes or rhonchi sounds, which is indicative of mucus in the lungs. Next, I'm going to assess your chest wall motion. And so what I'm going to do is have you face me. And I'm going to place my hands on your body. Is it okay if I touch you? Sorry, my hands are cold. And then what I'm going to have you do is just breathe normally. Okay, take a deep breath in. Okay, and then now I'm going to do your lower chest, or the middle of your chest. So I'm going to find your xiphoid process. Go up. Okay, deep breath in. Okay, and while we're here, I'm also going to palpate your diaphragm. So I'm just going to stick my fingers right in here, and then just take a deep breath. Okay, breathe normally. Okay, and if you could face the tree one more last time. So to assess his lower lungs, I'm going to find where his end of scapula is. Could you sit up for me? There we go. Okay, and breathe normally. And take a deep breath in. Okay. Okay, and face me. Okay, so you are very symmetrical when you're breathing, which means that both sides are activating at the same time, and your timing, they activate at the same time. However, it does seem like you're breathing more with your upper chest than your lower chest, because when I palpated your diaphragm, I could feel your diaphragm, but your upper chest was activating first before I could feel the palpation for the diaphragm. Which is something that we would work on, because the correct order of breathing is the diaphragm, then the middle chest, and then your upper chest. And so now we're going to begin with the interventions. Okay, you can start.